This week on Healthy Living, experts warn that millions of lives are at risk due to the HIV-AIDS epidemic. UNAIDS Executive Director Winnie Byanyima shares some insight in the fight against HIV-AIDS. And the Omicron BA.5 variant is driving a surge in COVID cases in several countries. Plus, a public sector hospital in Cape Town makes a unique move with robotic surgeries. These stories and more in this edition of Healthy Living. Hello, I'm Lina Khmoudou. Thank you for joining us on Healthy Living. Get this, more than 1.5 million people worldwide were infected with HIV in 2021, many of them young girls. That's according to a new report by the Joint United Nations Program on HIV-AIDS. Worldwide, only half of children living with HIV are on life-saving treatment. On the other hand, 3/4 of HIV-positive adults are receiving the antiretroviral treatment they need. The UNAIDS report says global disruptions, including the COVID-19 pandemic and the war in Ukraine, have slowed many HIV prevention efforts and made it challenging for some to access needed treatment and services. Annual new HIV transmissions have risen over several years in regions such as Eastern Europe, Latin America, and North Africa. The Philippines, Madagascar, Congo Republic, and South Sudan are among the countries which have seen the biggest increases in cases since 2015. Experts warn against complacency and the lack of focus on the disease. They say HIV remains a serious global health challenge. According to the World Health Organization, Africa is home to more than 2/3 of the global population living with HIV. What are your thoughts on HIV patients' challenges to have access to HIV testing and treatment in Africa? To what extent is lack of HIV testing and treatment a reality in your community? Here are some reactions from Nigeria.
I actually think that the problem with HIV testing is about the monetary issues in Nigeria. There's this private test you can do for yourself on HIV, and it's very expensive. I just found out it's very expensive. So why not reduce the price and increase the products?
What mostly we've been using from the meager the government could supply, most supplies has been from NGOs.
Donors, have withdrawn from supporting the HIV activity in the states now. So when the donors were really supporting us, we had surplus test kits. We have consumables, we have so many things to work with. But now the donors are not forthcoming again. So the supply of test kits, it's slow now.
Before now, we have people going to school, secondary school, go to share condom, how to protect yourself against this virus. But there's nothing of such now. Even in the hospital now, basically when you go for a test now, they're supposed to ask you, have you done your HIV test? At least a question should be asked, yes or no. When last did you go for your test?
And then government itself is not really taking it as priority. I think probably because of the reduction of the issue of death. So I guess that's why it has reduced in the sense of having places to test.
We have other hospitals that are major hospitals. We have even private hospitals that run HIV tests in the state. So people are still testing, and we are still in the fight.
The International AIDS Conference just concluded in Montreal, Canada. We spoke with UNAIDS Executive Director Winnie Byanyima and asked her to elaborate on some of the pressing needs in the fight against HIV/AIDS.
While we've been making a lot of progress on getting people on treatment, new infections we haven't done as well. Putting more emphasis on prevention is core to the new strategy. We have hopeful new technologies like long-acting PrEP, long-acting injectables is a very positive solution. Long-acting injectable treatment is also in the pipeline, could hit the market soon, but these must be accessible price-wise. So we are pushing hard with companies, asking them to make these new technologies available for those who need them at the right price. When communities are empowered to deliver, we see that people are reached with prevention or treatment services. So governments agreed that, for example, 80% of prevention services will be led by communities themselves. Let gay men deliver to gay men. Let sex workers deliver for sex workers. Put resources in their hands. Let them deliver to them. They know who needs to be reached. We call for more resources to be invested in continuing to search for a vaccine and searching for a cure. But once the resourcing is there, we also need the technologies, the new technology. We need the wealthy countries to share their technologies so that people can get the best that science has to offer at the right price. We need to remove those laws that criminalize people and stop them from enjoying their human rights and being able to come forward to get services. We need to fight stigma and discrimination. These, and put services in the hands of communities to deliver. That way, we can turn it around.
Cases of COVID-19 are increasing again globally, due in large part to the rise of virus variant Omicron BA.5. Experts warn that the new subvariant appears to be much more contagious than previous ones and can evade existing immunity in many people. Omicron BA.5 is driving a surge in cases in several countries, including across Europe and Australia, and has become the dominant variant in the US. Meanwhile, an updated COVID-19 shot could be available as early as September, according to experts. The modified vaccine will be geared toward the Omicron variant, the dominant Omicron subvariants currently. Here are some steps experts say you can take to live with COVID. Get vaccinated and stay up to date with your booster shots. Know your COVID-19 community level, whether low, medium, or high, and take precautions to protect yourself accordingly. Wear a mask indoor and outdoor. Keep rapid tests on hand if possible and use them to know your status. If you are traveling, find out how to get treatment in case of infection. Regional authorities, medical professionals, and residents of Ethiopia's Afar region say they are in dire need of medical aid, with hundreds of hospitals and health centers destroyed by conflict. The World Health Organization says it is struggling to fulfill the country's needs as crises around the world intensify. Henry Wilkins reports from Beral, Ethiopia.
Mariam Abdallah Ali lost her daughter in May after the toddler swallowed an object found on the floor.
But when we went to the local health center, they told us they could not perform an operation on her because they didn't have the right equipment. They said we had to go to the city of Samara for the operation, but my daughter died on the way.
Ali lives in the town of Bahale in Ethiopia's Afar region, where Tigrayan forces who occupied the region until April destroyed healthcare facilities before they left. The regional government says 60 health centres were put out of commission by the occupying forces, although Tigrayan forces and the Tigray regional leadership deny allegations. A doctor at the centre where Ali took her daughter said they no longer had the equipment to save her.
This health centre was one of those where medical devices were available. In the past, we used to perform operations because all the equipment and the medications we needed were here. But the TPLF destroyed this health centre completely.
The Tigray People's Liberation Front, or the TPLF, did not respond to VOA's request for comment on the damage in the region. In nearby Kanaba district, a health centre was ransacked and severely damaged.
The medical laboratories have been completely destroyed, and we cannot carry out health checks because we do not have medical equipment. even treatments for AIDS and diabetes. There is a big shortage of medications. Also, the lack of electricity has a negative impact.
A similar story at this hospital, funded by a German non-profit. While the need for food aid in Ethiopia has been dominating the headlines, officials say there is a great need for medical services too. The UN's World Health Organization says that just 22% of healthcare facilities are fully functioning in Afar and the neighbouring Amhara region, compared to the period before the conflict began in late 2020. The World Health Organization says there is a life-threatening shortage of medical services in Afar towns, once occupied by Tigrayan forces. The WHO told VOA medical aid and food aid must be combined to be effective in Ethiopia.
Whether it's in terms of essential supplies, whether in terms of monitoring for infectious diseases, whether it is in terms of immunization services or services for mothers and children. It's really important for these services to be provided at the same time as food.
For Ali, aid came too late to save her daughter, but for others, there may still be time.
A surgical team led by Dr. Tim Fogan uses the Da Vinci Z robot to assist in removing a cancerous rectal tumor from a female patient at Tygerberg Public Hospital in Cape Town, South Africa. The robot, which has 4 arms and is controlled in real time by Fogan via an immersive 3D console, is the most advanced surgical robot in Africa.
This is the Da Vinci Xi robot. It's assisting the surgical team at Tygerberg Public Hospital in Cape Town in removing a cancerous rectal tumour from a patient. With 4 arms that are controlled in real time via an immersive 3D console, it is the most advanced surgical robot in Africa. Da Vinci Xi is one of only 2 such robots in use on the continent. It's currently used mainly for complex urological, gynecological and colorectal surgeries.
Fortunately, the Western Cape Department of Health bought 2 Da Vinci robots, which is the Da Vinci Xi, which is the most technologically advanced surgical robot that's currently available on the market. What they do is they allow you to work very, very finely and with great precision, and they magnify the image that you're seeing a lot more than normal laparoscopic stacks, so we can see much more detail, and then the instruments you can maneuver with a lot more accuracy.
The first operation using the robot was performed at Tygerberg Hospital in February 2022. Dozens more have been successfully completed since then.
Patients have done very, very well. They go home much sooner, so our average length of stay is 3 days. So you have a major procedure, we remove big cancers, and 3 days later you're at home. And the complication rate has definitely come down. And chatting to the patients post-operatively, they have a lot less nerve damage. You can see that their function is way better than what we had originally. And we were doing all these ops with keyhole surgery, so we were already doing them with very small cuts, people going home after 5 days, now 3 days. They all tell me they feel as if they haven't had an operation.
Da Vinci is not the first robot deployed by Tygerberg. In 2020, the hospital introduced Kanya during the peak of the pandemic to help patients connect with their relatives via video or voice call. Lundi Moyeni is one of the patients who are able to communicate with their family members remotely.
Now with this innovation, bringing your family members closer to you, since they can't be able to physically come into the hospital, that brings in a lot of relief, and also it's good psychologically for a patient as well. So this innovation, it's quite good.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voanews.com. You can follow me on Twitter at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.